Welcome to the Soul of Medicine.
All right, welcome everybody. So my name is Dr. Kay Corpus, and we have Rob Kresh. You know us from the team of Soul of Medicine, and we'll be introducing our inaugural guest today. We're so excited. So welcome. Good morning for Diana. She's in Portugal. It's about 3 p.m. there. It looks brighter there than it does over here. We have a little bit of clouds over here. So this is Dr. Diana. She's a medical doctor trained in integrative and functional and lifestyle medicine applied to people with cancer. She's trained also as a Ph.D. in the field of palliative care, and she does clinical research. She's also a yogi. This is our connection, which I'll go into shortly, also specializing in cancer care. And she's currently practicing integrative oncology and lifestyle and integrative medicine in Portugal. And at the age of 35, she was diagnosed with a rare form of lymphoma, which made her question the essence of who she was and how she wanted to contribute to a healthier world. And she believes that the current cancer epidemic results from a profound disconnection with our inner nature and with the nature of the world around us. And Diana believes that step by step, we can return to the essence of who we are and to a healthier, fuller life. Above all, she has a deep interest in the resilience and wisdom of the human soul. So welcome. I have chills all over my body. Just
Me too. Yeah. Thank you.
You're welcome.
It's a pleasure to be here. It was your first podcast, so I'm super excited with that.
Yeah, of course. Of course. So we met in 2018, right? Mm-hmm. I believe. And I was actually in Brisbane, where you were living at the time with Carlos, your partner, and it was a yoga workshop. And then the following year, we went on retreat together in sunny, what was it?
Sunshine Coast.
Yeah, Sunshine Coast.
That's right.
Sunshine Coast, which was beautiful. And that was a lot of fun. And then we had some deeper talks at that time, right? Got to know you better and your interest in practicing this kind of medicine. I think you were right in the middle of your PhD program or toward the end of it.
Yeah.
Is that correct?
Yeah.
So could you tell us sort of what was happening around that time, around the PhD program, what you were experiencing and your diagnosis?
I knew I wanted to be a doctor at some stage, and I wanted to take care of people. And then at some stage, like many of us, I got burned out because it was so intense. And the PhD kind of was an escaped route, I guess, to get out of my clinical practice and get into something else. I love palliative care, so that's one of my fields of preference. So it kind of made sense. So at the same time, I had met my husband, Carlos, so it made sense to take this step, go to Australia, do something else, something different than clinical research, than clinical practice. But I guess I always felt that it wasn't really my place. I felt like I never really fit in a traditional standard medical care / medical research world. And I guess I was struggling when I met you in particular. I was struggling with just not finding a place professionally for myself. And I remember us having a conversation and something about leadership came through, and I just broke down crying because I wasn't really expecting that to come up in our conversation and that to be so relevant for me at the time. And then after a while, this was 2018, like you said, and after a while, I was just feeling in all domains of life very like I was just taking space, but not really living, I guess. That's what I was feeling. So the PhD became quite heavy at some stage. I was having also some disconnection from my family, which came from since I was a little girl, really. I remember maybe a week before being diagnosed. So my symptoms were actually, I had this itch all over my body, had this pressure in my throat. And that was it. So it took a while to be diagnosed, and I went to different clinicians. But I remember laying in bed maybe a week before I was diagnosed and thinking maybe it would be really so much easier if I didn't exist at all, like for everyone, for my family, maybe for my partner as well. And I'm not doing anything special in the world, so it would be so much easier. And I just remember so vividly thinking that. And then I got diagnosed. And for me, the diagnosis was a bit of, I don't know, it's just like a light came in, something like that. And for me, it was so obvious that you're not doing this right. This is not the life you want to live. So we need to change something here. And it kind of kickstarted the whole process of transformation. And that's when I reached out and we started speaking again. And I reached out to many other people and healers, and just to try to get myself back on track somehow and, live like a fulfilling life somehow. But yeah, that's what was happening before cancer. It was quite intense, actually.
Yeah.
Yeah.
So, Diana, you write so beautifully, and you wrote about this in your blog, but you speak about when you receive the diagnosis of cancer, it's not even the clinical brain doesn't even turn on, when you get things like that. It's like forget all the letters after your name, right? And you spoke about not more of it, what you thought about it, but how it made you feel. Could you speak to that more?
So, yeah, when I was diagnosed, it was that feeling of, it seemed like a dream to some extent. So there was, I think it took me a week probably to get to that place. I just mentioned that I know why this is happening and what I need to do. But before that, it didn't seem real. And I looked at my body and I was just feeling, how is this possible? Like, I look healthy. I feel to some extent healthy. And I can't even think there's something growing inside me that it's not so good, basically. So it didn't feel right or true, or it's like a dream state in the beginning. And then your clinical brain completely shuts off. Once they tell you the diagnosis, I think that's the moment you become a real person instead of a clinician. Mm-hmm. And you just take it in, and everything rushes around you. Everyone is rushing and trying to get you to the hospital, trying to get you to and rushed admission, I guess, because no one was expecting that. Family is kind of collapsing a little bit as well. So yeah, it's difficult to get to that state, and then you just don't feel like you're in your body. And I remember even being admitted to hospital. It was so interesting. So I was admitted to hospital. I was diagnosed in one day. The next day I was in hospital because they were afraid that I wouldn't be able to breathe by myself, basically. And I was admitted because there was no vacancies in the hospital. I was admitted next to the men I used to see as a clinical researcher. These were people with chronic obstructive pulmonary disease in a completely different area. That's the only place they had for me. And it was so surreal just being there with all these different people I used to see in my research practice, I guess. And I remember going to the CT scan, for example, and seeing my name on the screen and just thinking, it looked like a movie, the whole process, because I was so used to living that as a clinician. And I never thought it could happen to me. And I think everybody says that. And of course, you conceptually think maybe someday I will go through this, but not at 35. I wouldn't think. And not so soon, not in a foreign country, it was just a combination of factors that made everything so surreal for me. Yeah.
So it's really interesting because, as a practitioner or as a caregiver, you see somebody get that diagnosis, but we forget, or the patient or your internal experience, how chaotic that is, it sounds like, and lost, or like out of
Yes.
body, it sounds like. And you speak to use the word, I think it was really interesting how people use war language,
Mhm.
and that you'll beat the disease or use these therapeutic weapons, or that kind of verbiage, which you say is triggering, and you know
Mhm.
and you need to be the fighter, and we're going to beat this,
Yeah,
and and you say it's hard to be a fighter after the sixth round of chemotherapy. Like,
exactly.
I, I
Yeah.
mean, that's so profound to me. Even, I mean, I think this is something that, us from the outside, and those of us who haven't necessarily had this experience to understand. Could you speak to why that kind of language wasn't helpful for you in particular?
Yeah, and this is such an interesting topic because, I've heard about some people who find this type of language helpful. In my case, it started really early in the beginning. You're going to beat this, people around me saying, you can beat this, you're going to destroy cancer, you're going to smash this. And it just didn't make sense to me. Like I couldn't compute that I was going to put this armor suit and just fight against my own body. First, because I didn't feel like a fighter at all. Like something happened to me, and now I don't know. I just wanted to love my body and give myself the conditions to be able to heal. But whenever I even thought about going into war with myself, which was basically that, it was just so tiring. I couldn't bring myself to fight anything. I wanted to rest. I wanted to just give space to my body, give space to my soul as well, because I hadn't stopped for a while. Um, just space to discover who I am, to go through the illness and to learn something about it. um yeah, but I just wanted to be myself, to just let it just follow its own course, let the body do whatever it needs to do. But I didn't want to fight it. No, I felt like fighting it was actually worse, because I was fighting my own body for a long time. Like I was fighting to stay awake when I wanted to sleep. I was fighting to not eat because, I needed to work. And I was fighting with my own body nature for so long that I just didn't want to fight anymore. And certainly not against cancer, because, it's such a huge thing. So I just wanted to support my body and love my body through cancer, basically.
I love the fact that you're really articulating this. I've had several patients in stage, and they're there with their partner, and their partner's like doing everything, and I could see that it was such a chore to have a conversation. And
Yeah.
from the outside, we I guess impose what we want for their survival,
Yeah.
and them to you know whatever. And so, yeah, the mere fact that it's like, I don't want to fight, I want to rest, and to actually articulate your need, because it's almost like we don't ask what your need is. We
No.
want what we want for you, what we think you
Yeah.
need.
Yeah, and
Yeah.
and I think there's an additional burden on around cancer, and that's the fact is, when we hear the word cancer, and it doesn't matter if it's your family or your friend going through that, but we all panic a little bit, and we just want to make it better because it's so heavy on everyone. And especially, I really felt that when you see it in a 35-year-old, it's freaking scary for everyone. Everyone just looks at you, and then you can see their mind realizing, if this happens to you, and you're healthy and you eat well and you practice yoga, then it can happen to everyone. And that's quite scary for people, even though they can't articulate that sometimes. So I fully understood that. And I fully understood that people were trying their best. But I guess the challenge is that you can, sometimes we just need people to be there and not make the situation better, and not try to fix anything. It's just, all right, you're going through this and I'm just here, and we can do nothing together, basically. We can just be together. And I'm not trying to fix it. I'm not trying to heal you. I'm not trying to change anything about you. We're just going through this together. And I was super lucky also with my partner, Carlos, because um, he had a really interesting approach naturally, I guess. And that was, he would provide as much support as I needed, but at the same time, he kept doing his own life. He kept living his own life. He would do yoga. He would work when he could go to work and I didn't need him. So that kind of took the weight out of me to experience my disease, cry when I needed to cry, just, feel my emotions and not be worried about him. So that was another thing that really helped me throughout the process. So yeah, it's funny, how people react. Everyone has different ways of reacting, and I guess the challenge for all of us is that we're all going to die at some stage. So talking about death and life-limiting illnesses and cancer in general can actually be such a great opportunity for people to get closer together, and to open up and to be vulnerable and to, just spend quality time together and learn more about each other. But it's too scary, and sometimes we don't allow it to happen, basically.
Thank you so much for talking about that. And you and I have had these conversations, and Rob and I do, and everyone here who is has been through our program and knows how we practice and why we're called soul of medicine. So, looking for this deeper root cause, and of course there could be physical things with that. And I know some of the people on the call now are like, if I take my supplements and I do my yoga and I meditate and I manage my stress, I won't get cancer, right? And it's like, yes and no. And, there's sort of that unknown sort of thing, right? And I think for you too, you began to search for a root deep meaning, and so we did talk about emotions, and can you talk more about how emotions and negative ones can affect our physiology? And this goes, when we say your story as cancer, we're also talking about chronic disease states as well, right? Because it's applicable as well. And could you speak to, how you understand emotions and the physical body and disease and illness can happen, and also what you thought your root core sacred wound, was, if you can.
Yeah, that's such a beautiful question and such a complex one as well. So I guess in a broader sense, I think cancer is super complex and we can't really narrow it down to one thing. But I usually, when I'm in appointments with my patients, I usually ask them, do you have a sense of what caused this? Do you feel like, because for me, it was so obvious when I was sitting in the hospital, it was so obvious that I knew what was triggering that, what was causing that. And it was all about stress and emotions. And for me, it was a state of repressed anger, repressed sadness, repressed everything, feelings and emotions. Basically, I'm super good with that, still super good with that, and working on that. So yeah, I just have, because that was my pattern since I was a kid. I was the invisible child. I wanted to make myself small. I wanted people to notice me, but at the same time, I didn't want them to notice me. So because it was too scary and I don't want to trigger anyone. I didn't want to upset anyone. So I consciously throughout my life made myself as small as possible, not to bother anyone. And and that so my parents went through a bad divorce when I was a kid as well, and I'm an only child. So that the whole process was about making myself small and pleasing them, because I had the sense that if I wasn't well behaved, they wouldn't like me, they wouldn't love me, and all of that. So, and that worked for me for so long, and then that I think that's what created the sense of disconnection, of being miserable, of not knowing why I was in planet Earth, not knowing about my soul mission or how to apply that. So I was lost. I was completely lost of my essence, if I can say that. I think that's the case, and I guess that's what was so interesting when I talked to UK in 2018 when the leadership theme came up. It was so unexpected in the middle of all of this, because the themes of my life had been completely different from that. And but once the diagnosis happened, it was just, this is it. This is what needs to change. And also because my family and here we had a very difficult relationship. When I gave them the news, cancer has a way of making everything big around you. So every pattern that was there and I hadn't seen, cancer came and amplified that. And at some stage for me was like, well, this is not working, and this is really not. I think some of the patterns between myself and my family, I only saw that for the first time clearly when cancer was involved, because for me it was so outrageous that I had cancer even, and I was still worried about other people. So yeah, so that was a major shift for me. And I think for me it was because I was doing everything well. If you think about all the eating properly and practicing yoga and doing all the by the book things, but at the same time I was so disconnected from my own body. And I really like, I guess, the most beautiful description of health and wholeness really I've heard was from Martha Beck. She talks about integrity and just having, being aligned with what your body wants, what your soul wants, what your emotions are there to tell you. And that integrity, putting everything to the service of your soul, that's what makes you go forward. And if you have a missing piece, and in my case the missing piece were emotions, then everything is off basically.
And I think that what you just said is actually the primary root of it all. And it's so hard sometimes to touch that piece. We have to go through these layers, I would say, like peeling an onion of the physicality, the sleep, the gluten, the dairy, the hormones, the this, and then you finally get to that deep root core. And that's, we're not taught as a society, even, I mean, we're taught even to just numb the emotion. So we're not taught to even have to have them, or that it's even safe to express them, or much less be in touch, with them. So I think that is so key and so beautiful. And so, we talk about, the Chiron's return. So that, I sent this email out and like what this podcast really is about, because there is this journey, I believe, that we all go through, all of us, of this wound, the sacred wound that we have, whether it's our worthiness, our lovability, our deservedness, all of that. The wound presents, which oftentimes it is physical, because that's what gets our attention. You know what I mean? I mean, we wouldn't,
Yeah.
if we could function, we're not paying, we're just going on with our lives. So something stops us in some way. And then we really have to look. So as Rumi says, pain is the portal in
Yeah.
and that's how I look at disease. It's like, okay, that's the pause. Like, what do we need to, we've been running so fast, so long, and then how do we, and I think you're just this quintessential Chiron of turning this wound into this gift now, which is, to me, it's like how you're just living your life is just the example. It's just the teaching. It's so authentic, um and we'll show you guys her writings. We'll give you her website, but it's so stunning. And now you're offering it to the world. I think that's just this linear path that we all need to understand, but we get so like caught up in like, I have this and this and I can't do this. We don't understand this 30,000 foot view of what is actually happening to us. You know what I mean?
Yeah.
We get lost in
Yeah.
the mundane, and then we get stuck there. So could you speak to that, transition or journey?
Yeah. It's interesting because even now, people when people come to me and they have a situation of cancer and they want to improve their lives, first thing is supplements. They all come for supplements, and it's interesting because I think supplementation obviously has an important place. But it's almost like we're trying to replace pills by supplements, because it's an easy fix, because we can take it and it's easy. You do it once or you do it twice a day or 3 times a day and it's done. And it's easier than getting to these layers that are really painful. And sometimes people look, for example, to my journey in particular, and you can see, well, she was living this life and then she had cancer and then she transformed her life into something different and she's helping other people in the same situation. But what people don't see is the highs and lows in the process and the really deep inquiry and the painful situations that go in the middle of it.
Could you briefly speak to advice that you would give to somebody diagnosed or going through the process? And then my second question would be, what advice would you give to practitioners who interface with cancer patients and those with chronic illness?
Yeah, so patients, usually I when I have a patient in my medical appointments, I guess the first question, especially when people tell me I'm scared of dying, I usually ask, what are your reasons to live? Because I want them to focus on that, not disregard the fear of dying, because that's completely normal and we should process that as well. But what I want to know is, what are your reasons to keep being alive? Because I strongly believe, and this is based on research as well, that when you have a purpose and when you know what you're here for, then you kind of assume this, you kind of think, I don't have time for cancer, I don't have time for this disease, because you have so much stuff to do. And while you keep your mind and your heart engaged in something that it's meaningful for you, I guess that's how we start the process. And then from there, we can explore the deeper layers, the deeper emotional layers, what's missing, what needs am I not responding to. And if you get a chance to work with your body in a conscious way, I think that's beautiful, because part of the process of cancer is like any trauma, we need to disconnect from the body because the body is not safe anymore. And if not during cancer, but certainly after, just having the chance of reconnecting to your body like a friendly space. That's what we do. We do that a lot in my classes, just turning inwards and feeling the body like a friendly space and getting to know the new signals that come from the body, and not just disconnect when something stressful happens. So these are kind of the it's difficult to kind of focus on everything, but these are kind of essential things. And for health professionals, for health professionals, I think it's so easy in a way, but so hard in others. People just want you to be there with your heart and soul and completely available for them. And it's just that, like, I went to, so after when I was diagnosed and after I consulted all these health professionals, I went to acupuncture session and she sat down, she heard my story and she started crying. And it was the first time I thought someone had an appropriate response to what was going on. It was sad. I was young. People were scared. It was sad. And she let herself cry. And for me, it was so liberating because there was someone, she wasn't doing anything special. She was just recognizing my experience and recognizing it was something important and sad. And I think that's basically what we need. We need people to see us and not to try to fix anything or to change anything around us. Yeah.
And that's something that we don't, as practitioners, we forget or don't think that that's important, or like all I can do is listen, and how even our humanity gets lost somewhere, where this is really the essence of hopefully why we go into these specialties, right? So yes, that's beautiful advice.
And also we tend to hide ourselves and our feelings as health professionals behind all these information. So I will give you information. So now you have this cancer and now we're going to give you more and more information. But as soon as you get your diagnosis, you're really not listening anymore. You're not listening to information. So you're not really there. You're there to filter essential information, but the rest and the most of it is actually providing support. It has nothing to do with information. If people want some more information, they will ask. But in general, I feel that that's not what people need. People just need support and someone to hold their hands and guide the process. And that's it. It's really simple and hard at the same time because you need to deal with your own feelings.
It's really beautiful. So thank you so much.
No, thank you. I really loved the experience. It's such an honor to be here because I found you and Rob in such a vulnerable time in my own process. So I kind of see you guys as mentors as well. So it's just so beautiful to be here with you and collaborate in some way. Yeah.
Thank you for listening to this episode of the Soul of Medicine podcast, where science meets soul for whole health healing. Are you ready to reclaim your energy, vitality, and soul purpose? Then feel free to head to our website at kcorpusmd.com and schedule an appointment for your root cause review.